Welcome to Reducing Conflict and Protecting Kids, Solutions for Challenging Custody Situations, presented by Dr. Donald Archer Gordon and Dr. Malissa Tigges. This is a Simulive webinar. The content was pre-recorded, but you are with a live audience and live webinar host. If you have any questions or issues, you can use the live chat and our host will answer you as soon as possible. Please use the Q&A feature to ask any questions you may have during the presentation. You can find the Q&A button on the bottom toolbar. Non-anonymously asked questions will be answered by Dr. Gordon and Dr. Tigges via email in the following weeks after the presentation. A fully recorded webinar link and certificate of attendance will also be emailed to each attendee. We hope you enjoy this educational webinar.
Hi, my name is Dr. Malissa Tigges. I'm a licensed forensic and clinical psychologist. I work in high conflict custody cases, focusing on protecting kids and supporting safe parenting. I also train professionals on trauma, supervised visitation, and alcohol use in custody settings.
I'm Dr. Don Gordon. I'm a clinical psychologist and the executive director of the Center for Divorce Education. And I've been involved with educating parents who are divorcing for about 40 years and helping them get through this traumatic experience with their children and parent-child relationships.
The Cycle of Conflict, Understanding Adverse Childhood Experiences, ACEs in Custody Cases. How ACEs can increase the risk of repeated trauma, and why early awareness of its impact can reduce conflict and protect the next generation.
So we know that custody disputes are some of the most stressful experiences that families can face. They not only affect parents, but do have a profound and lasting impact on children. We are going to talk about one of the most impactful experiences that children can go through before the age of 18, also known as adverse childhood experiences. Adverse childhood experiences, or ACEs, are traumatic experiences that we experience before the age of 18. They include abuse, neglect, violence, or parental separation. And research shows that these events can shape health and relationships for their entire lives. Let's briefly look at this ACEs quiz, a tool that was developed to assess childhood trauma. It talks about 10 categories ranging from abuse and neglect to parental separation, domestic violence, and substance use. The ACEs quiz helps to measure childhood trauma, and the higher the score, the higher the long-term risks. So we're going to go through this ACEs quiz with everybody that's participating in our webinar today. And what I would like for you to do is just silently take your score. It's completely confidential. It's out of 10. So for every question that is asked, if you answer yes to this question, you give yourself a point. So the first ACEs question, for all 10 of them, it's going to be while you were growing up during your first 18 years of life. Did a parent or other adult in the household often swear at you, insult you, put you down, or humiliate you, or act in a way that made you afraid that you might be physically hurt? If you're answering yes in your mind, please give yourself a point or count 1. Second question. While you were growing up again during your first 18 years of life, did a parent or other adult in the household often push, grab, slap, or throw something at you, or ever hit you so hard that you had marks or were injured? If yes, give yourself a point. Question number 3, while you were growing up, did a parent or a person at least 5 years older than you ever touch or fondle you or have you touch their body in a sexual way, or attempt to have oral, anal, or vaginal intercourse with you? Yes, give yourself a point. Question 4, did you often feel that no one in your family loved you or thought you were important or special, or your family did not look out for each other, feel close to each other, or support each other? If yes, give yourself a point. Number 5, did you often feel that you did not have enough to eat or had to wear dirty clothes, had no one to protect you, or your parents were too drunk or high to take care of you or take you to the doctor if you needed it? Number 6, while you were growing up during your first 18 years of life, were your parents ever separated or divorced? Number 7, were any of your parents or other adult caregivers often pushed, grabbed, slapped, or had something thrown at them, or sometimes are often kicked, bitten, hit with a fist, or hit with something hard, or ever repeatedly hit over at least a few minutes or threatened with a gun or a knife? If yes, give yourself a point. Number 8, did you live with anyone who was a problematic drinker or alcoholic or who used street drugs? Yes, give yourself a point. Number 9, was a household member depressed or mentally ill, or did a household member attempt suicide? If so, yes, give yourself a point. And the last question, did a household member go to prison? If yes, enter 1 point. All right. So out of all of these ACEs scores, as we mentioned before, the higher the score on this ACEs quiz, the higher you're going to have some long-term risks. Here's some of the risks. Between 0 and 3 ACEs is lower risk. Obviously, between 4 and 6, much higher. And over 7 points on this ACEs score would mean very concerning that you would suffer with a lot of difficult issues that we'll be speaking about today. Even one ACE can impact a child, but multiple ACEs, common sense dictates that will have cumulative effects on their health. There are some key findings. This ACEs quiz came from a pretty groundbreaking study by Kaiser Permanente in the 90s. And they found that 2/3 of adults report at least having one adverse childhood experience in their history. 1 in 5 adults report having 3 or more adverse childhood experiences in their life. And these higher ACE scores are obviously linked to things like depression, anxiety, PTSD, substance use, and physical illness.
The impact on this type of stress when it's chronic for children is pretty devastating. When children are under trauma and stress, their bodies release hormones that physically damage the developing brain. The amygdala, when it's activated, and the amygdala is part of our brain that produces the fight or flight response or freeze response. And when cortisol is released, that has harmful effects on the developing brain. And we know that, for instance, it affects the hippocampus, which is children's ability to remember and learn and regulate their emotions. So when they're under this kind of stress, they don't do very well in school, for instance. When they're developing this stress, can have lifelong effects because of the way it affects the brain, and it affects their physical and mental health throughout their lives.
One of the things that I really enjoyed about this study, Dr. Gordon, was that it kind of showed that our idea of trauma that we thought of once, that everybody develops normally or on the same line, and then a traumatic incident occurs which changes the trajectory of their development. But now, knowing that if they are growing up in an environment where they're not only predisposed for certain conditions because of their parents' issues that they experienced growing up, but now they're growing up in an environment in which these things are going on, it's going to change the structural. It's not just a normal functioning and then trauma happens, changing the trajectory. They're growing up in a traumatic environment, and this is changing the structure of their brain and how their nervous system develops. So that absolutely is going to lead to some health issues later on in life, in school, with relationships. They'll struggle with learning, self-regulation, and of course, in an unstable custody situation, that can compound the risk.
Yeah. And there's even evidence that they don't live as long as people who've not had this kind of chronic stress. So it shortens their lives.
Yes.
And maybe through associated things like abusing alcohol and other substances, and dealing with the trauma as adults, which will shorten their lives. This stress will disrupt their healthy social development with their parents, with their peers, with their siblings, and their ability to form secure attachments is impaired as well. And that goes into adolescence and adulthood. And quite often they'll have difficulties if they marry or have a live-in partner that has difficulties in those relationships, and there's a greater chance that they're going to go through multiple separations and divorces. Having this chronic stress, they're more vulnerable to abuse and neglect and psychological effects of those. So if a parent is not paying attention to them, for instance, because a parent have their own stress, they're abusing substances, they're distracted by chaos in their lives, then that's neglect for the children, and that increases the damage it does to them. So they're an increased risk for maltreatment if they're having these high ACEs scores, and they're just a lot more vulnerable than kids whose ACEs scores are not high.
Laying the groundwork for safety, the role of therapeutic assessments in reducing conflict. How early trauma-informed intake assessments help identify risks, tailor supervision strategies, and create conditions for healthy parent-child interactions.
We know that the divorce is the second most stressful life event in one's life, and the loss of a spouse is the most stressful life event. And so the second most stressful life event happens to so many children in this country and other countries. That's a lot of trauma that people are having to deal with, and people are not skilled and educated in dealing with this kind of stress. That means that the parents need some education about how do they protect their children from this kind of stress and the breakup of the family. And the education that they need is involved with how to be able to speak to the other parent and cooperate with the other parent without triggering each other and getting involved where both parents are involved with fight or flight, and in which they can't solve problems together.
Absolutely.
So they having this co-parent education is necessary for parents to be able to get through these events without making their own lives and their children's life a lot more stressful and a lot more stress hormones being released. There are several risk factors for child maladjustment, going into later childhood and adulthood, and one of the big ones is loss of a parent. So if they're losing contact with a parent because of divorce, they're a greater risk for maladjustment. It takes a lot of wisdom and patience to raise a child, and children do better if they have two parents doing that and two parents cooperating and raising them. So if they lose one of their parents, not only do they have that attachment disrupted, but the remaining parent has to do that parenting by themselves. So one of the things that we focus on in our divorce education classes is, the importance of both parents staying involved as a family is breaking up. And this is good information, particularly for a parent who's angry at the other parent and wants them out of their life and wants them out of the child's life. When they learn about the risk to the child from losing contact with a parent, that motivates them to put their own anger aside and to support the other parent being involved with the children. Another risk factor besides loss of a parent is ongoing parental conflict and triangulation. And triangulation means when the child is put in the middle of the parent's conflict. And we discovered through our research at Ohio University decades ago that was one of the most harmful effects of divorce, was children being put in the middle of the parents' conflict, and where they feel like whatever choice they made, they were going to anger or hurt one of their two parents. And we found out that parents were involving the kids in their conflict in subtle ways, and we're not aware of that. And we would ask children how often the parents would put them in the middle of the conflict, for instance, using them as messengers, criticizing the other parent in front of the children, complaining about how the other parent uses money, quizzing the children about the other parent's personal life. Parents frequently do that. And when we ask the children how often this happens, they said this happens all the time. When we ask the parents say we almost never do this. So the parents were simply unaware that they were doing it. And it became important in the divorce education program to show video scenes of parents triangulating the children so they could recognize what they were doing and learn how damaging it was to the kids. And we find that if parents are abusing substances like alcohol, that affects both of those things. The ongoing parental conflict will increase because they're less sensitive to the effects of their conflict on their children because they're high. We also, they're more likely to lose a parent. If one of the parents has a chronic drinking problem, the other parent will often be opposed to the children's contact with that parent because of safety concerns.
The role of an ineffective family environment can make children highly susceptible to some negative psychological impacts. This can happen not even in the context of abuse or neglect. If a child is growing up in a dysfunctional family with ineffective parents, then they're going to grow up never being provided the tools needed for healthy psychological functioning, which places them at greater risk for enduring issues later in life. This is why I conduct a brief yet thorough intake assessment with all parties before providing any sort of intervention or services in the context of a high conflict separation or divorce. This is crucial for several reasons. It allows me, the supervisor, or my supervisors to gather essential information, establish rapport with the family, and ensure the safety and the well-being of the child or children during visitation. Additionally, it helps us to understand parental history of adverse childhood experiences, which can provide us with valuable insight for appropriately supervising these interactions between the parent and the child. Therapeutic services and psychological evaluations, the importance of considering these parental ACEs in supervised visitation settings. Here's why it's important. That intake assessment will allow the supervisor to assess for any potential risks or safety concerns that might arise during the visit. And understanding the parent's history of ACEs will shed light on their coping mechanisms, some of their triggers, or their behaviors that impact their ability to appropriately parent the child. This information will help us take necessary precautions to ensure the children's well-being. There is a trauma-informed approach to this. Parental adverse childhood experiences can influence the parent's ability to effectively manage their stress and regulate their emotions. Therefore, they are going to have a harder time engaging in positive parenting practices. So by knowing their trauma history, the supervisor or judicial professional can adopt a trauma-informed approach to understand the parent's behavior, that their alcohol use disorder, for example, is not a moral failing, it's a response to trauma. And we can ensure empathy and sensitivity and support, which will promote their healing and better interactions between them and their child. Tailored intervention strategies, knowledge of the parent's ACEs can inform the supervision strategies. We can use this information to approach strategies that mitigate any sort of potential triggers to re-traumatize the parent or the child. For example, if a parent has experienced domestic violence, the supervisor can then use that information to establish clear boundaries, provide a safe environment, and intervene promptly if there's any signs of aggression or distress during the visit. And this process helps us to build trust and rapport with the parent. Through the intake process, we're actively listening, we're demonstrating understanding, we're validating their experiences and creating a supportive environment. And this helps the parent feel comfortable sharing their concerns and asking for that guidance and engaging in this effort to improve their parenting skills and their relationship with their kids. If you can identify a parent's adverse childhood experiences through this intake assessment, it can also help you to facilitate appropriate referrals and support services. The parent's trauma history will affect their ability to safely interact with their child. Therefore, they can be referred to trauma-informed therapy or other parenting programs, such as ones that you will receive at the Center for Divorce Education, other resources that will address their specific needs. And this is a holistic approach that will contribute to positive outcomes for both the parent and the child. So in summary, conducting a brief but thorough intake assessment with a parent before supervising any visit is crucial for ensuring the safety of the child, but also understanding their history, the parent's history of adverse childhood experiences. That helps them to empower, it helps to empower the supervisor and the parent to tailor any interventions in a trauma-informed way, and so that the parent can receive the necessary support so that they can have an excellent, positive, quality parent-child visit.
Yeah, Melissa, that's so important for the supervisors and the parent to know about the trauma history and how it affects the parents. And quite often, this is new information for the parents, and they don't realize how they're currently impaired because of their trauma history. So having them take the ACEs test can be really helpful in understanding that, and they can develop more compassion for themselves at the same time knowing that they're going to be facing more challenges than a person who doesn't have this trauma history.
It's almost one of the most formative, groundbreaking psychological studies for me personally and professionally. I have taken the ACEs quiz, and I've mentioned this in previous presentations before. I'm not ashamed. I score very high on the ACEs quiz. But what I use with that information is risk is not destiny. I just take it as information as to what types of risk I am faced with and how to better take care of myself. I do know about different predispositions within my own family system, and I just use this information to understand myself better. And yes, give myself grace, like you said, Dawn, take better care of myself, but also understand why I'm experiencing some of these thoughts or feelings or patterns of behavior and how better to intervene. So I really, really appreciate the ACEs quiz and all the information that it gave us as a profession, but also using it personally in my life.
Right. It sounds like it made you more vigilant to look for situations that can be triggering, and to know that those are challenges for you because of your history, and you're more motivated to learn methods to calm yourself down, to be able to get your prefrontal orbital cortex involved, your higher brain centers involved. So the tools are there that we can help ourselves and help others function at a higher level. You simply need to know that it's important to do that and to be on the watch for that.
It also just
Like
helps
you,
it helps to know what you're up against. And then you don't take it as personally, like if you're struggling with some sort of symptoms or some sort of unhealthy coping mechanism like alcohol use disorder or something like that, to just know that about yourself, give yourself grace that it's not a moral failing, that you experience certain things and now you know better for it, and you're certainly going to do better for the next generation because we're not going to repeat some of those same patterns.
yes, yes, and looking at those ACEs questions, and not only did it have me looking at myself, and my score is a little higher than I thought it was, but thought about my children too, and that what happened with my daughter. She's got some ACEs higher scores because of what happened in her childhood, and that's news to me. It helps me understand why she's been seeing a therapist for so long.
Replacing accusations with accountability, using technology to reduce conflict. How tools like Soberlink create structure, foster trust, and keep children out of conflict in addiction-related custody cases.
Well, we all know that we can't avoid stress in our lives. When the stress gets to be high, a lot of us are in the habit of turning to something quickly that will relax us. And that alcohol is probably the most common thing people do to relax when they're stressed. Quite often people, when they get home from work, will open up a beer or have a cocktail or have a glass of wine. When they're with friends in the evening, they'll stressed about their day, they'll drink alcohol. So it's effective in relaxing people, but it creates longer term problems. And a lot of people learn this as children when they see their parents being stressed, and the parents go to the refrigerator and open up a beer or make a drink. They learn that this is what you do when you're stressed. So kids are very susceptible to learning from what their parents are doing. The parental conflict it produces stress. And when we're under stress, we're more likely to assume the other parent doesn't have good motives. We're more likely to see the other parent as a threat to us. We're more likely to not be able to empathize with the other parent or see their point of view when we're under stress. So all of these things create conflict. And let's take a look at a video clip that demonstrates that.
Chronic daily stress strengthens the neural connections in the amygdala, the part of your brain that controls fear. Unfortunately, the more you repeat a negative thought pattern, like fear or anger, the stronger and deeper those connections become. Chronic stress causes these connections to grow stronger, which produces even higher levels of cortisol. This decreases your brain's ability to handle stress. It can also impair your brain's ability to receive information properly, such as telling the difference between a serious and not so serious threat. Another problem is that high levels of cortisol from chronic stress can actually damage your hippocampus, reducing memory and emotional control. daily, chronic stress might make it more difficult to learn and remember things, and can also lead to very serious mental complications such as depression, memory loss, and a reduced ability to feel emotions. And these same deteriorations can happen in children's brains, where there's greater impact because their brains are still developing and growing. The good news is that you can reverse the effects of stress and cortisol on the brain. You can benefit from improved concentration and learning, so you can make better decisions about what to do, especially in social situations. And this benefit will be passed down to your children. Two of the best ways are exercise and meditation, both of which require deep breathing and focusing on your surroundings. Regular exercise trains the body to have a better response to stress, which in turn helps to decrease the release of excess cortisol. Meditation, even for 10 minutes a day, also lowers excess cortisol and reduces anxiety caused by stress. These simple practices can decrease stress and improve brain function, helping you to protect your brain from long-term effects of chronic stress.
Yes, what the message that we're giving to parents in this is that although they make a lot of mistakes that harm their children, divorce and separation is really tough on them. And it's normal for them to be to go into fight or flight and to do things that they wish they could are not doing. So we want parents to know that this is a tough time, give themselves a break, take care of themselves, give themselves time to learn new skills. And the message also is that there's things that they can do to reduce these risks for themselves and their children.
A lot of these ACEs questions are talking about chronic issues. Most of these things, they can be overcome, like divorce, even though it is extremely disruptive to the stability of the children. If it's not a lot of conflict, they can overcome it. They can grow resiliency to it. But for most of these ACEs questions, the longer this is allowed to draw out, the more cortisol hormone is being released in their little systems. That is going to be the greater predictor of long-term health impacts. If it's very chronic and it continues on and on, there has to be intervention at some point. I do think parents should feel a little consolation if certain things happened where they lost their mind and they acted poorly in a certain situation. But again, if these issues are allowed to happen over and over and over again, the chronic conflict, that is really the most damaging thing to the children. Obviously, high ACEs scores are going to increase the risk of alcohol misuse later. And if you think about that, if you have gone through a lot of adverse childhood experiences, you've been through emotional abuse, physical abuse, heaven forbid, sexual abuse, witnessing domestic violence and things like that, it's going to increase your risk of using alcohol and substances to cope later in life. And especially if family members, that you're blood related to have also struggled with these conditions, then there could be a biological predisposition for alcohol abuse disorder. So like I was saying earlier, not only might you be struggling with a predisposition, but you also grew up in an environment where drugs and alcohol were used to cope with stress and things like that. And so having a lot of adverse childhood experiences is only going to increase the risk of alcohol misuse later in life. And some of our parents struggling with alcohol use disorder will often face challenges with some emotional regulation, with their mental health, and with their parenting. And this will pass down trauma to the next generation. Alcohol use disorder is a chronic medical condition characterized by an individual's compulsive and problematic pattern of alcohol consumption, commonly referred to as alcoholism or alcohol addiction. It is considered a mental health disorder and is diagnosed based on specific criteria outlined in the DSM. The best way that I know to diagnose substance use disorders and alcohol use disorder is to measure the impact to a person's functioning. They're unable to function. It's affecting their relationships at work, their work productivity, perhaps affecting their relationships with their children, their co-parenting, their emotional regulation skills are out the window. because they are in this cycle of coping through alcohol abuse. So understanding adverse childhood experiences and alcohol use disorder in custody settings and providing early intervention. Parental substance use will pose risks to the safety and well-being of the children. Mental health professionals such as myself and Dr. Gordon can conduct comprehensive assessments of their risk and use this information to develop safety plans. I do a lot of, for any services that I provide as a psychologist to my clients, I always do a thorough intake assessment at the beginning. If I were to be providing therapeutic supervised visits between a parent and a child whose contact has been restricted, perhaps because the parent acted unsafely in the past due to alcohol abuse, I would want to know about that history. I would want to know about the parent's history of adverse childhood experiences so I can understand their risk and develop an appropriate safety plan to ensure that that parent and child have consistent contact with each other, but that it's safe, quality, positive contact between them. So I will do a thorough mental health intake and develop a safety plan. If you are a mental health professional or a supervised visitation professional, this information will provide you with guidance and help you support parents who are struggling with this condition. It will also help set clear expectations and boundaries for the parent who is struggling with alcohol use disorder during any visitations. So one of the great tools that we have to monitor alcohol use disorder in our parents that are struggling with this condition and also maybe experiencing a custody battle, there is Soberlink, which I'm here on behalf of to speak to you today. Little disclaimer, I do not receive any personal financial gain from speaking on behalf of Soberlink. I really, really just value the tool that it is. It's a portable breathalyzer system that is used to provide remote alcohol monitoring. And it's unlike other alcohol breathalyzer devices in that it is not punitive. It's more of an accountability tool. One of the ways that this can really help in custody settings is a parent can be monitored by this Soberlink device. They can sign up for a certain level of monitoring by the Soberlink company. And with so many tests during the day, we're able to see that for a period of several hours over the course of all the entire day, that this parent is not consuming alcohol. If you take that into a custody or a visitation setting, then this results can be used to determine the safety of a parent. What I also love about the Soberlink device as well is what we've been talking about here with Dr. Gordon is not triangulating the children. Some of our questions send unintended messages to our kids, and sometimes we are triangulating them and not realizing it. What I really love about the Soberlink device is that it's discreet, it's non-punitive. Essentially, it will help the person just remain as accountable to their sobriety plan. And then also it reduces interacting and triangulating the children. We don't need to ask our daughters or sons how mom or dad was acting on the visitation and if they were intoxicated or not, because the real-time data collection will send those results and those notifications to the interested parties right away. I also really think that not a lot of parents have gotten behind this idea, but if a child already is aware that a parent is working a path towards recovery and sobriety from alcohol use disorder, it's really healthy to show your kids that you have a tool like this and that you're breathing into it to ensure that, so they have the trust as well that mom and dad are okay for that visit or for that time sharing.
When the parent is quizzing the kids about the other parent's sobriety, that puts the kid in the middle. Yep. And in our program, we show the parents quizzing the kids about the other parent's new girlfriend or lover. And again, that puts them in the middle. So if the child answers honestly that the other parent was drinking, they're going to get that parent in trouble, and they know that. They're going to get the parent asking, they're going to get them angry. So the child's in an impossible situation. If the child lies and covers up the other parent's drinking, then they're going to feel guilty about that. So it's a horrible situation to put the child in. When the monitoring is done automatically, then the parent doesn't need to ask those questions. They're having a much more reliable source of information about the other parent's substance use than their child. So I'm glad you brought that out, and it made me more appreciative for what Soberlink can do with keeping the kids out of the middle and triangulating.
Dignified solutions in high custody cases. Other monitoring systems, not Soberlink, will lack accuracy. There will be legal implications. Soberlink can provide that real-time data. And therefore, the other systems are inadequate systems of support for recovery. They're also much more punitive. They're attached to different probation requirements, sometimes like that. There are ankle bracelets. It comes off very punishing, and it does not promote the accountability that Soberlink does. Where Soberlink is really, it's not a catch you type of alcohol monitoring device where catching you using alcohol is going to come with punitive measures. It might affect whatever court orders were put in place to protect your children if you're not compliant with those orders. However, it's going to provide real-time data to the players that are creating these court orders for you. It's going to be highly compatible with facial recognition. You're going to know that parent, how much they consumed, how much is in their system, that it was them that took that test. So many great qualities and features of the Soberlink device compared to others.
Reframing reactions, repairing relationships, teaching parents skills to break the cycle. How high conflict programs help parents manage emotions, model resilience, and create calmer co-parenting environments.
Separation and divorce are among life's most difficult and stressful events. A relationship that you thought would last forever has gone bad. There is tremendous disappointment, deep sadness for the loss of your dream of a happy family, and often intense anger, bitterness, and conflict before, during, and after the breakup. You may be in a high conflict divorce or separation, which means that you may be in the middle of negotiations or returning to court because you and your ex cannot agree. Your life is in turmoil and the future seems uncertain. But you can get through this. And with the right skills, you can better communicate with your ex or co-parent and reduce tension and conflict in your relationships. Okay, let's begin with the basics. What is conflict? When is conflict too much for you and your children? The truth is, every relationship has conflict. A lot of the threat and discomfort you feel when you're in conflict comes from an ongoing feeling that you have failed. These bad feelings can make you overly sensitive to the slightest criticism from the other parent. Criticism from your ex or co-parent is a reminder of your failure. Oddly, it's easier to deal with anger than with feelings of failure, sadness, and depression. When your relationship ended, you were likely to be in emotional shock. You were hurt. One partner usually reaches the point where he or she gives up on the relationship sooner than the other partner. As a result, the person initiating the breakup may be ahead in the healing process from the trauma of breaking up. Regardless of when a breakup happens or who causes it, most of us judge ourselves as having failed. Your internal judge is harsh and can sabotage you. Here's where the brain's wiring gets in the way. When we perceive a threat, in this case criticism, part of the primitive brain, the amygdala, is activated. When this stress is triggered, our reaction is to freeze, to fight, or to run. You'll be learning about how to gain control over this automatic reaction so that you can make calmer, wiser, and better choices in times of conflict.
Okay, the video clip you saw was an introduction to our High Conflict Solutions online program. And that was Shep was the host, explaining to parents what conflict was and how it affects them, and the importance of being kind to themselves and understanding the stresses that they're under. The purpose of this program is to teach skills to the parents to, instead of just giving them information, it's to teach skills so they can change their behavior. And some of the skills we focus on is respectful communication skills, so that they can avoid triggering their co-parent. Another skill we teach them is recognizing the subtle ways they put the kids in the middle of their conflict. And our earlier research had shown that parents often do this without any awareness. So when parents see themselves in the different scenarios, we show real life scenarios with parents having conflicts and children being present, they learn how to keep the kids out of the middle of the conflict. And that's an important skill because triangulation is one of the most negative aspects of divorce and separation. We also teach them skills to regulate their emotions. So as they learn about the brain and the amygdala, the fight or flight, we teach them how to calm themselves down so they can engage different parts of their brain to help them solve problems. There's a total of 8 scenarios that depict parents having conflict, and we show a wrong way and a right way. The reason we show a wrong way is that parents can recognize in the actors on the screen, they can recognize themselves doing that wrong way. Then the program explains why it's a wrong way, why it's not helpful, why it didn't help solve problems. Then we show them the right way where they see the same actors who made a mistake, then using skills to better solve a problem with the other co-parent and showing more sensitivity to the kids. This class takes about 8 to 10 hours for the parents to do, and they log in multiple times. Instead of going to a physical class, we had to be present at a certain time. They log in and log out when they're ready to learn. Quite often when parents have to go to a physical class, they may not be ready to learn. They may have had a really bad day at work. They may be really stressed because their co-parent is in the class. May not be a good time of day, but with an online program, they can pick the time to log in and log out. And the program remembers where they were, so when they log in, it takes them to where they left off. The instructional design of the program fosters retention and use of these skills. So the content is remembered because of the repetition of the skills, because of we cause a brain shift every 10 minutes so that they can continue to pay attention. We use videos that are relatable, that have an emotional hook, and that the parents can see themselves in this. And so we also show parents different ways they can practice the skills. We give them opportunities during the program to practice the skills. So the whole point of the instructional design is to make sure that they remember the material. There's no use giving parents a program that a week or two later they don't remember the content. So our purpose is to change their behavior and to help them use skills to do that and to remember and use those skills. What parents really enjoy about the program is the neuroscience aspect. They didn't know about the brain and how their brains cause them to do things that they're not proud of. We teach them that their brains are wired to perceive threats and to keep them safe from threats. Quite often the threats that parents respond to when co-parenting is not really a life-threatening threat, but because their brains are programmed to respond this way, they get into fight or flight mode pretty quickly. So we give them information about how to spot that and how they can prevent their brain from going into fight or flight. Let's take a look. One of the ways we teach parents about the brain, instead of talking about it, we show them animation. And most parents are visual learners. You'll now look at a video clip showing that.
When you understand how your mind works, you gain more control and lower your stress. Here's how your mind works. The higher outermost layers of your brain are known as your cortex. When you use this part of your brain, you're accessing your cortical mind. Your cortical mind gathers information from the senses, which we call perception. They can also be stored and retrieved as memories. Sometimes our cortical mind makes creative changes to those representations, which we call imagination. The cortical mind also reasons and processes thoughts. When our cortical mind can perceive, know, imagine, and reason, we can problem solve, and so our lives work better. But for the cortical mind to function to problem solve, there has to be enough safety. There's a part of your mind that is always working on knowing whether or not you're emotionally and physically safe. If the answer is not safe, you leave your cortical mind and go into your brainstem, whose function is survival. Here you can still sense things, but the information is less detailed so that it can be transmitted rapidly, allowing you to act quickly. An important part of the gateway between the cortical mind and brainstem is the amygdala, which helps you to know how you feel and if you are safe. When you feel safe, the pathway opens to your cortical mind, and you can process different ideas and possible actions much better, allowing you to make good decisions. An example is when you hear a car backfiring and you immediately become startled. Your amygdala, or fear center, forces you to downshift into your brainstem. After a brief moment, you relax a little. Then your cortical mind starts to process more of the information it received, helping you assess that there is no risk, that the sound was not a gunshot, but a car. For combat veterans with PTSD, the neural circuits that react to loud noises are so hardwired that their stress reaction to a car backfiring is prolonged and intense. Their cortical mind, or thinking brain, doesn't kick in for some time. And if you're a parent in ongoing stressful conflict, it is similar to PTSD. Your stress reactions can also be intense. It is difficult, but you can teach your brain to soften your response to perceived threats.
So in addition to educating parents about how their brains get in the way, we show them methods for softening their response to the perceived threat. We treat them methods for reducing and preventing an amygdala hijack. And some of those methods involve slowing their breathing down, taking several mindful breaths, paying attention to their senses, regulating their emotions through the vagus nerve. So these methods are taught to parents in the program so they can calm themselves down and prevent the amygdala hijack that I just mentioned. We focus a lot in this online program on video scenarios. And the reason we use video is that teaching parents new skills is best done either through live demonstration of the skills or video demonstrations of the skills. Most of us are visual learners, so we want to learn something new, we have to see how it's done. And so that's why we use a lot of video. We don't want parents to be spending 8 to 10 hours looking at a talking head of some professional like me telling them about all this information. They need to see the skills demonstrated. If there is an emotional hook in the videos, that guarantees they're going to pay attention. And if the scenes are relatable, they're going to know that this involves them. They're seeing parents on the screen making mistakes that they also show, and that causes them to pay more attention. Now we'll show you now another video clip. A common issue that comes up between separating divorcing parents is how the other parent spends money.
Often, both parents believe that the amount of court-ordered child support is unfair. This sense of unfairness is likely to be felt every time money issues come up. Parents all too often unload their anger about money directly onto their children, and each parent usually has opinions about how the other parent spends money. Fighting over money is the biggest reason divorce and separation come about in the first place, so it's no wonder the problem comes up over and over again when, during a divorce or separation, the tension is higher.
Dad, our class is going on the field trip to the museum, and there's this $10 fee due tomorrow. Hi, Jolene. Anyway, I told Mom it was due soon, but she forgot to give me the money. So I was wondering if you could write me a check for $10.
Are you kidding? That's what child support is for. You see what I mean?
Oh man, your mother is always forgetting to pay for this and to pay for that, and then she expects me to pay for it? What does she think child support is all about? The money I send her every month is supposed to pay for everything. For your school fees, your music lessons, your clothes, all your video games, your toys. I just wonder how much of that money she really even spends on you. She's just so stingy when it comes to buying stuff for somebody else other than herself. And aren't you tired of wearing clothes from discount stores?
Well, yeah, but she doesn't make as much money as you do.
She could, if she would use her head more and work harder. She makes enough money to buy herself shoes all the time, and she gets her hair done at least twice a month. She really does receive enough support to put you in better clothes.
Now, in this next scene, notice how Dad responds very differently after he has learned to be more mindful of his own reactions. He's also using a skill called stop, look, and listen. With this technique, you stop yourself from reacting emotionally using any one of the self-soothing tools, then look at all your options for responding and listen to your better nature and choose the best response. In this scene, you'll see that Dad is attuned to Everett's distress when Everett is caught in the middle, so Dad comes up with a different solution.
I'll try to remember she's always stressed about money. Hey, it's me. Everett asked me today for some money for his field trip. And he was nervous. I felt bad for him even having to ask. Lynette, look, I just think this is something that child support should cover.
Everett is nervous because he knows how stingy you are with money. I better not say that. Why didn't you just give him the money instead of making it a big deal? You have the money.
I hear you. I know you're worried about expenses. I just want us to agree on which things Everett should ask each of us for, so he doesn't feel bad about like he's putting us in a situation where we're going to get angry. Can I suggest some guidelines?
I'm listening.
All right. So whenever he needs money for things that child support should cover, like school expenses, then you'll just give him the money in time for those events. And if he needs something small, like, those sunglasses I got him last weekend, I'll take care of those.
Okay, after parents see the scene, and they can relate to this because these are common issues between divorcing and separating parents, the host will explain, why it's harmful to the kids, and will prompt the user to look for the use of skills. So they'll specifically talk about skills that are going to be coming up. So the user looks at those and pays attention to those. One of the important parts of instructional design is repetition. And it takes 5 or 6 repetition of a skill for people to be able to remember it. So we don't show a skill such as stop, look, and listen, or iMessage, or active listening just once. We'll show it about 6 times throughout the program so that parents see it in different contexts. The content is in the videos is reinforced through guided questions, which are screens that come up during the program in which parents can see. They see a question and they see the answer to the question. We'll take a quick look at what the guided questions look like. Now, all of the text in the program can be read aloud. There's a toggle that parents can turn on so they can hear the text read to them.
Transition from one parent's home to the other's. They need quiet time and gentle support from each parent. They need time to decompress from the strong feelings of divided loyalties. Children may shut out one or both parents during these times as they struggle with feelings of loyalty to the absent parent. If conflict between parents occurs, it can take the children and the parents up to 72 hours to get the cortisol, a stress hormone, out of their systems.
Okay, so there was another chance to reinforce the skills they're learning is through the guided questions. Another common scenario in these households is parents who avoid talking to each other, and the consequences of the children when they don't want to speak to each other. So we'll take a look at a video clip of that.
Another common situation is that when parents tend to fight a lot during exchanges, they avoid conflict by simply not talking to each other. They act out their conflict in other ways, and the children notice. In this next scenario, Dad is about to arrive too early, and both parents become passive-aggressive.
It's true. I'm gonna be early again. But not that early. Only about 20 minutes. I really look forward to my time with Ashlyn. But what I don't get is, why can't Laura just drop her off at my place? It's all about control. That's why. That's why we didn't make it. She has to control everything. Yep. I'm 20 minutes early. I know Laura's gonna give me shit about this. Well, I'm not gonna give her the chance. I'm just gonna sit tight.
Well, he's early. No surprise there. He's just trying to manipulate me by trying to extend his time with Ashlyn. Anything to push my buttons. Well, he can just wait. I'm not going to give him extra time with Ashlyn just to talk about what a bad mom I am.
Now let's see that scenario again. Jay is still arriving early, but both parents handle things differently. They each become mindfully aware of their physical reactions to stress and to their thoughts and feelings. This will allow them to make better decisions about how to calm themselves down and respond more cooperatively. Let's watch.
I guess I need to let Laura know that I'm going to be a little bit early again. But even if I do, she probably won't let Ashlyn come out. I think it's her way of manipulating me. God, man, it makes me so angry. No, wait. I know. I can't assume that I know her motives. I really need to be aware of how this is physically affecting me. My breaths are labored and short. My teeth are clenched. The neck muscles are tightening up. I just need to take some deep breaths and try to relax. Much better. Okay, what if she says no? I can't get all pissed off if she does. It's very important that Ashlyn doesn't feel this constant tension between her mom and me. I need to just give her the benefit of the doubt and just assume that they're busy. I guess I just need to fake it and act like everything's fine. Look, I can't stand Laura. That'll never change. But I love my daughter more than I hate my ex. And I know it's hard on Ashlyn to see her mom and I fighting. So I need to pay attention to her feelings. She doesn't need to hear every complaint I have about her mom.
Why is he coming early again? Wait, I need to not assume his motives. I mean, at least this time he's being friendly and asking instead of just showing up and demanding. I'll answer him. But I need to be brief, informative, friendly, but firm. He's here already? Hi, Jay.
Sorry, I'm a little bit early. I sent you a text about that. How have you been?
I guess he didn't get my text. Oh well. At least he's not trying to push my buttons, which is nice for a change. I know he just wants to spend more time with Ashlyn. I just need to stay calm about it, for her sake. My day's been fine, thank you. Pretty busy though. I did get your text, and I just replied.
Oh, okay. There we go.
Oh, she hasn't eaten since lunch, so I'm sure she's hungry. So if you could get her something really soon, that would be great.
Sure, we can do that. I'm planning on taking her to my brother's house, and he always has fun snacks there. You excited to see Uncle Al?
Yeah, that would be cool.
As you can see in the video clip, whenever a skill is used, it's labeled on the screen. So it's another way we're teaching parents how to recognize a skill and how to use a skill because they're seeing it demonstrated. And throughout the program, they'll see that particular skill demonstrated 6 different times or more. One of the things that we teach parents in this high conflict solutions program is that they're being aware of their own stress is really important because they're not able to really tune into their children when they're in a stress state, when cortisol is in their system, when they're in fight or flight. I didn't notice it at the time, but when I would pick up my son for visitation a long time ago when he was a young child, and his mother and I would have some conflict, when I picked him up, then I would, after driving away with him, I would be still distressed because of that conflict. So I was completely unaware of how he was feeling, and I wasn't checking in with him. And he was, I'm sure, distressed as well. But young kids don't have the vocabulary to express what they're feeling, and often don't feel like they have permission to do that either. So he's likely to keep it to himself, particularly being a boy and the male role models he sees in his life, not being real expressive of emotions. So he's internalizing this. And I'm not tuned into the fact that he's quiet and it's something that's probably going on because I'm distressed. I really wish I'd had this program, went through my first divorce. Well, in order to let the parent know that the children are looking at this very differently, I want to play a video clip called "A Journey Through the Child's Eyes." And parents they tell us afterwards that this is really helpful at seeing the divorce or separation from a child's point of view.
Mommy loves me, yes, I know, as she always tells me so.
The most difficult part of my parents' divorce was when they would fight, and my dad, he would leave out screaming. There would be fighting, there would be things thrown.
They didn't really pay attention to me because of the situation.
I sometimes thought that it was my fault that they got divorced. But now I realize that it wasn't really my fault, that it was their choice.
All I knew is, okay, Dad was just kind of gone for a while. I thought he would come back, but he never really did.
It wasn't one of those divorces that was kind of agreed. It was kind of one of those divorces that was, my mom just got really angry and just kicked him out of the house.
You're kind of confused. You don't really know what's going on because they've been together your whole life. And it scares you at the same time, and just everything is chaos, basically. You don't really know what's going on, and it's just a really scary moment.
We'll also show at the end of the course, we'll show a video of a child writing a letter to its parents and then reading the letter out loud. And parents tell us that's really, really impactful. And it makes them stop and take a look at themselves when they're hearing a child's typical response to this divorce and separation. Okay, there's some important skills that relate to dealing with alcohol misuse. And one of the most important ones is using an I message, where a parent states their feeling about what the other parent is doing or has said, and then asks for a change in their behavior. So, for instance, when you're a half hour late coming to pick up our daughter, it makes me worry that you've been drinking and you've forgotten the time. Next time, I'd like you to let me know if you're going to be late, and if you've been drinking, let's cancel the visitation. Another important skill is stop, look, and listen. And that's where you stop yourself, you look at all your options, and then you listen to your better nature. So we encourage parents to know that they have a better nature. They have a place in their minds and hearts where kindness and compassion resides, and to bring that forth. Self-talk is another really good skill to use when dealing with alcohol misuse, where the parent plans what they're going to say to the other parent who's been using drugs or alcohol. So how do we get parents to use the High Conflict Solutions program? Divorce professionals sometimes have the ability to mandate it. Certainly judges do, and this is one of the most common ways that the program is used for the judge's requirement. The judges require both parents to use it. Also, if you're talking to parents like you're an attorney, is to talk to the parents about their shared goals for the children, that they're more likely to be able to help their children meet those goals, like to do well in school, to avoid behavior problems, to treat other people kindly, by talking about how the program can help with those goals. You can let parents know that there's a lot of things that parents do that they're unaware of that has negative effects, and they're going to learn some things that they didn't know before. And once they learn about that they can lessen those things that can have a long-term impact on the kids. Also telling parents that their reactions to stress can certainly be improved, and that they can learn new techniques to deal with stress and new techniques to deal with challenging behaviors by the co-parent. And finally, parents will say, well, what if the other parent isn't using these skills and they went through this program, they're not doing it, what should I do? And we argue that you should set a good example. Use those skills because you're setting a good example for your children, regardless of what the other co-parent does.
So this presentation has focused us on adverse childhood experiences, and they remind us how deeply children are shaped by conflict and instability. Custody disputes and parental alcohol misuse can add to those risks if they're not addressed. That's why we recommend practical tools like a family evaluation with a thorough intake assessment to determine the parents' experience with adverse childhood experiences.
We've also learned about an online program that helps parents deal with their emotional triggering, helps parents deal with the conflict with the co-parent, and helps them attune to their children, and also teaches them to give themselves some grace in going through this very difficult process.
And that's also why we rely on Soberlink monitoring devices, which provide accountability, safety, and a path forward for parents working towards recovery. Together, these approaches will reduce conflict, protect children, and give families the chance to heal. Whether it's through high conflict solutions programs that teach healthier co-parenting or Soberlink monitoring that ensures safety and accountability, the goal is the same: protecting children and creating stabilities for families. Thank you.